Hello, everyone, and welcome to our product roadmap update for Gentu. And thank you all for taking the time to join us today for this update. I would like to begin today by acknowledging the traditional custodians of the land on which we meet virtually today. And for me, based in Brisbane, that's the Turrbal people and the Yagara people. And I would also like to pay my respects to elders past, present, and emerging. My name is Niamh Topin, and I'm the Director of Product Strategy and Design at Magentus. I'm going to be your presenter today. I also have Sian and Eden Howard, the Gentu Product Manager, on with me as well, and they'll be joining us for Q&A. But today I'm going to talk you through the Gentu Product Roadmap. I'm going to begin with sharing what we've released recently in what's new and improved, and then also what you can expect to see in the Gentu product over the coming months. As I mentioned at the end, we're going to have a Q&A. There is a Q&A box though at the bottom of your webinar screen. So please add your questions to this chat throughout the webinar. If we can answer them as we go, we will. And then we'll also take some time to answer a few at the end. So we probably have 20 to 25 minutes of presentation, which gives us a good amount of time at the end to talk through any questions that you might have. So before I jump into the product roadmap update itself, I just want to spend a minute sharing a little bit about our platform vision, as this is how we see ourselves helping you, the medical professionals, deliver better health outcomes in the coming years. And our practice management systems vision is really centered around our technology platform, which we've been working on for a number of years now. And it's really important because it's what's going to allow us to provide ongoing product innovations into the future. Some of these we will develop ourselves, and some of them will be provided with alongside third parties through integrations. But all of these innovations really are targeted around key three objectives for us. So one is how we can provide tools for practices to automate the patient journey and provide a more modern experience and touch points for patients. The second is focused on how we can connect up what is a very disconnected health ecosystem today and ensure that practices have the data that they need at the point of care with patients. And the third one is really about how we can bring data-driven insights into your workflow. So this could include things like clinical decision support. It'll also include workflow assistance and insights on how you might be able to improve your practice's performance as well. Alongside these objectives, though, we do have Genie and Gentu, of course, which are our core practice management system products. And we continue to invest in the core workflows of helping you book and manage appointments, consult with your patients, bill and manage payments from those patients alongside these objectives. And so a lot of what we'll talk about at the beginning of today is really going to be centered around enhancements in the core Gentu experience. And then also what you can expect to see from us in the core experience in the coming months, and with a number of integrations that we have ready to be launched quite soon. So I'm really happy to share that Gentu continues to thrive. And actually recently we hit a really exciting milestone for us, which is 2,000 practices. As we look at the number of specialist practices that are moving to the cloud each month, we know now that about 40% of all of Australia's specialist practices have actually shifted to the cloud. And for those that have shifted to the cloud, more than half of them are using Gentu. So what that means is Gentu is the fastest growing cloud practice management software in Australia. And we now have more than 2,000 practices using it. This means that Gentu practices are supporting the care of more than 14 million patients, have provided more than 47 million appointments and 5.6 billion in health services, which is a huge impact on the health system in Australia. Over the past year, we've really been focused on how we can improve the core experience of Gentu for you, and also get Gentu ready for Genie customers to migrate to. And we continue to have a number of teams working on core Gentu. We're going to continue to have a team that is focused on our mobile app experience. And we now have 2 teams that are really dedicated to establishing integrations into Gentu. But to identify, which are the most important core features and integrations for us to be working on, we continue to listen to the feedback from you on what needs to change. Over the years, we've built a rigorous voice of customer program, which is really centered around capturing feedback from every touch point that we have with you. So this could be a call with our support team or an interaction that you have with our training team on site. And this feedback repository now has thousands of pieces of feedback, and we regularly review this each quarter to understand, what is the most important thing for us to focus on. The feedback earlier this year in January really highlighted workflows associated with managing billing, payments, and claims, and managing outgoing correspondence as the key areas that you wanted to see improvements in. And that really heavily influenced our roadmap for the last 6 months, and also is influencing what we're going to do in the coming 3 months. Within managing billing, payments, and claims, you really specifically wanted to see improvements to quotes and invoices with over 800 feature requests in this space. You also asked to see some improvements to how claim exceptions were addressed, and that was something that we dealt with earlier in the year and spoke about in the last webinar. And then there's also some feedback for improvements to how payments and refunds are managed. Some of this is around auditability, and some of it included the ability to be able to more easily make amendments to payments once they have been made. Within managing outgoing correspondence, the key themes there are you're wanting to have additional references for letters for patients and third parties. You're also looking for more flexibility in letter templating and how letters are formatted to ensure that, it can look, your documentation can look really professional. And then finally, you want the ability to be able to send letters via an addressee's preferred channel. So the primary themes here are really email and fax, and being able to communicate with third parties via email or e-fax. In June this year, though, we also ran a survey in Gentu asking you about which third-party products you would like to see integrated to Gentu. We've been working on the foundations of our marketplace for over 12 months now, and we really are on the precipice of making this available to all Gentu practices, and have a number of practices in a beta program. And therefore, we wanted input from you on what problems were the highest priority for us to focus on. We had over 400 responses to this survey, which was really great, and excellent representation of both people working in administrative roles and practitioner roles. The number one thing for us to work on, though, from your point of view, was patient forms. So this was really centered around the capture of demographic information for both new and existing patients. This was really closely followed by digital consent for treatment and procedures. And then we had kind of similar levels of demand across payments, inbound referrals, online appointments, transcription, and telehealth. And so we've been using this data now to really inform partner selection for our marketplace, which I'm going to talk to you about in a little bit more detail later, about who some of those partners are, and specifically what use cases we already have available, and what we'll be working on this specific quarter. Before we do that, though, I'm going to take a look first at the features and the experiences that have been created in Gentu off the back of your feedback. In this last quarter, we have been very focused on invoicing and quotes, particularly templates, responding to those 800 feature requests that I mentioned just a moment ago. The initial improvements focused on quotes, and specifically the ability to create and customize multiple quote templates. So this included letterheads, differences in item descriptions, how the fees are displayed, and an area to include information that was relevant to either different practice locations or practitioners, such as payment details, payment terms, and any disclaimers that you might want to include. You can now choose how the estimate of costs is formatted. In particular, you can have control over what is bolded in the estimate of costs so that you can control what pieces of information are highlighted for patients. We also introduced the ability to create quotes for third parties. So very similar to the invoicing workflow now in Gentu, you can choose the other option and then select from the account type drop-down menu a third party, such as work cover, and generate a quote for that third party. Then more recently, work focused on making quotes editable within the workflow. So you told us that during the quote process, sometimes you want to be able to add additional information that's just relevant for this patient before actually printing. So that was released. And then finally, to wrap up improvements in the quoting space, the team enabled the ability to void a quote. So if a practice created a quote for a patient in the past, and that quote was no longer valid for that patient, it wasn't possible to be able to remove it in any way. So now you can, though, go in and you can void a quote from the patient's account history. The next area then for financial improvements was invoice templates. Now, improvements to invoice templates have been a recurrent theme for feedback for quite some time. So very similar to quote templates, practices can now create invoice templates that can include doctor-specific information. So we know this is really important for multi-practitioner sites and allows you to include any additional information on invoices that may be specific for that practice location, that practitioner, and include things like, again, the payment details or payment conditions. What you'll also see here is that when creating an invoice, you'll see on the right-hand side, a new invoice template button, drop-down menu was added where you can select the desired invoice template that you want to use for an invoice. And you can also set the default here on a per provider basis. So that really drives some efficiency in not having to select that each time for a particular provider. And that really wrapped up, those improvements for us in both the quote and the invoicing template space. Now, earlier in the year, the team released some changes, or the new process folder, which really allowed practices to upload, link, and process documents, so scanned in documents and files to patient records in bulk. So this meant that if you wanted to attach files to multiple patient records, you no longer needed to, search for each individual patient and attach them. It also included the ability to add tasks and notes to attachments and removed the limit that we had previously for 10 attachments at any one time. As an extension to this piece of work, the team then followed on with updates to the reviewing document process, with the goal to provide a very robust reviewing process to enhance clinical safety. So one of the big changes that was made here was the automatic linking of results and letters so that they're directly accessible within the patient's clinical file. So what's happening there now is that if we're able to identify a single patient in the database that matches the first name, surname, and date of birth that's found in the document, the patient will be automatically linked to that document without any interaction required from the user. And so this means that this document then appears in the patient's clinical file, as well as the incoming results and incoming letters area. So I guess the benefit of this is that if the doctor happens to see a patient before they've cleared out their results and letters inbox, that document is now available in the patient's clinical file for that doctor to review without having to jump out of the context of the patient's clinical record. While in this space, the team also separated linking and reviewing. So we heard from many practices that linking could be done by administrative staff, whereas the reviewing and actioning really needed to be done by practitioner or clinical staff. So it's therefore now possible to complete the link action for patients that haven't been matched without actually reviewing it. So this supports integrating the review process seamlessly into the patient's clinical record for times when that's appropriate. Now, in saying that, we actually have received some mixed feedback from users about this specific change since we released it last week. For some use cases where the person linking and reviewing the document is the same person, the feedback is that it's now multiple clicks to review a document where it was one click previously. And we've also heard from some practices that it isn't mandatory for them, for a clinician or practitioner, to be reviewing these documents. And so they're wanting to have some flexibility in how this is managed depending on the practice use case. So we are taking some time to think about this feedback and understand how best to address it. But we really are listening to this, and you can expect to see some further tweaks in this area in the coming weeks as we respond to that feedback and make sure that you guys can process documents as efficiently as you could in the past, because we never want an outcome where something is less efficient than it was previously for you to do. Now, other small changes that have been made in the review process include the ability to assign documents to other practitioners to review. So this is handy when you're maybe covering patients for, or I guess in a multi-practitioner practice anyway, or when you're covering leave or something like that. We also introduced just down the bottom here an audit bar to track the interactions that have occurred with that document. So this provides visibility, date and time of who has interacted with that specific document. And then finally, when reviewing a document, there's always been a table of icons in the top right-hand corner that allowed the user to complete various actions for a document. So this included things like doing clinical annotations or creating a task. In this recent round of changes, though, we've added a new function in there, which is the ability to send an SMS message to the patient. So this is specifically useful for diagnostic results, where a user wants to notify the patient to either call and make an appointment with the practice, or perhaps that, the result was fine and that no action needs to be taken. That person that is reviewing can actually take that action straight away. Now, outside of core Gentu, then, having a look at the mobile app, we also continue to make really good progress on the mobile app, which was released generally to everyone late last year. Earlier this year, the team working on the mobile app added a number of pieces of functionality, which included the ability to see other practitioners' appointment books, the ability to add a consult, add a task, the ability to create a new patient on the go. But just last week, we released our biggest update yet, which included the ability to review and action incoming diagnostic results from within the app. So this includes now, just if you see down the bottom of the mobile screen, a new tab for results that has permissions and filtering, enabling you to manage what you're viewing within that area. It also includes a new or an improved result viewing area that has improved formatting. And then, of course, the result review workflows. So this gives you the ability to link to a patient, create a new patient, and then, of course, take action or create a task for that result as needed. So we're really thrilled to be able to provide this capability within the Gentu mobile app. And this is actually closing out what was the #1 requested workflow for the mobile app from our Gentu users, which is really great to see. And then finally, in what's new and improved, I just wanted to take a chance to remind everyone about some new integrations that are available with Gentu. And this includes e-requests and e-bookings. So e-bookings is a digital procedure booking workflow that saves practices time when booking theatres. So this is initially available with HealthScope hospitals, but we are aiming to get it available with more hospitals over time. And the key thing is that it's free for all practices to use. Sorry, my light has gone up. It takes the patient and procedure information that you've already entered into Gentu and shares this across to the hospital bookings team electronically. So it's removed the need for, continuously sending draft theatre lists. It also allows you to upload the consent form at the time of doing the booking, which really reduces the incidences of where, patient paperwork is lost, or needing to then, either fax that, scan that in, and send it separately in an email to the hospital bookings team. We're also hearing from practices that this has improved the patient experience. Because the booking goes across to the hospital either on the day of the consult or soon after the patient has had a consultation with the doctor, patients actually receive confirmation from the hospital straight away that their procedure booking has been received. So this means that they're not left wondering, what's happening with their procedure booking. And it also is providing both the hospital and the patient opportunity and time to identify if there's any potential challenges with that booking. So particularly around things like health fund eligibility. And so what we're seeing is that it's reducing the incidences of last minute cancellations for patients as well, which is a really great outcome for both patients and practices. E-requests is then a digital pathology requesting workflow, which allows practices to create, send, and view digital pathology requests directly within Gentu. And again, there's no additional cost to this for the practice or patients, of course. So originally we partnered with Sonic Healthcare for the first release of this, I think initially back in last November, and then we had a broader release in March. And so that was available with their labs, which is Sullivan and Nicolaides, Douglas Hanley Moore, Melbourne Pathology, and Clinipath. Now we're really delighted to share that e-requests is available for Helios Labs. So this includes QML, Dorovich, Laverty, Abbott, and Western Pathology, depending on which state that you're located in, as well as a few other smaller labs that are managed by the Helios Pathology group. But this now accounts for, a significant percentage of the pathology requesting, or the pathology labs that you would be requesting to. It's actually available in Gentu as we speak, and there will be some further communications coming out about this to all practices next week. So when creating that request, as I said, the request is sent directly to the lab, and an SMS is then sent directly to the patient. So we've heard so many stories now from specialist practices that patients often lose their request form, or there's situations where the patient isn't in the practice and you're needing to send request forms before consultations or ahead of procedures. So at the moment, practices would be printing out request forms, scanning and emailing those to patients. And so this just removes all of the admin overhead associated with that, which is a big efficiency gain for practices, and also a better outcome for patients as well. They can just present that barcode or that QR code when they go into the lab, and the lab has all of the information, or the collection center has all of the information there ready for them to go. So as you can see, lots happening again in this last quarter for Gentu. So thank you all for the feedback that went into us focusing on this area. And thank you also to those people who are working alongside our product development teams. It's really important for us to hear from you around, how we can design and build these solutions to make sure that what we're building really meets your needs in now and on into the future. So now, having addressed a number of customer requests in the first half of this year, we did take some time to understand, what our focus should be for the second half of this year. And I'm sure many of you are interested in seeing, what we're going to be working on for the coming months. Interestingly, even having closed off over 800 feature requests earlier this month in the kind of managing, billing, and exceptions space, it's still the #1 area for feedback. Now that we've dealt with the invoice and quotes templating requests, though, the focus has shifted away from templating and is more focused on continuing improvements to how exceptions are handled in Eclipse, being able to modify quotes and invoices after they've been created, and similarly, being able to manage better management of payments and refunds. And then the area that remains from January, which was the second highest volume of requests, is really in that managing correspondence space. And as I spoke about earlier, many of the feature requests there really relating to letter references and the ability to email out to third-party organizations. So this has really fed into what we are going to be focusing on for the kind of coming 3 months. Now, to begin with, though, the first next thing that you'll see released for the Gentu product is most likely going to be an uplift for our multi-factor authentication experience. So since the mobile app was released last year, we did receive some feedback about the login experience and the absence of multi-factor authentication in the mobile app. So the mobile and the Gentu teams have been working in the last couple of weeks on improving the multi-factor authentication experience across both products. And look, multi-factor authentication significantly enhances cybersecurity for the practice because it requires, multiple forms of verification before somebody gets access to your sensitive practice information. So this really provides, an additional layer of security for unauthorized access. And patient data is really valuable. And it's often targeted by cyber criminals, unfortunately. So we really will be encouraging all practices to adopt and turn on MFA once we have this update available in the coming weeks. From here, though, we are going to be getting stuck into that letter writing feedback. So starting with increasing the number of letter references available to practices. We really do appreciate that all inbound correspondence requires a reply, and letter reference data from, where data is stored in other parts of the application can really expedite that process. So we're going to be adding in letter references for new demographic fields, new fields in clinical, antenatal record or antenatal data references, references for gender pronouns, and then also new references for an increased range of date selection. So for things like procedures, consultations, and so on. As mentioned earlier, we've had lots of feedback about needing to be able to email practitioners or third parties. We actually have over 200 voice of customer requests for supporting communicating with care teams or being able to CC a care team member or a third party in a letter that is emailed to a patient. So we understand that practices are currently downloading letters or saving the letters to PDF and then emailing these external to Gentu, which is obviously inefficient. But it also means that there's no visibility or auditability of what has actually happened with that document within the Gentu clinical file for that patient. So this quarter, the team will be working on enabling the ability to email practitioners from within Gentu. Now, alongside this work in the letter writer, the team will also revisit our obs and gynae module. So I did mention this last quarter. So we built the ONG module a number of years ago, and we had received some feedback about feature gaps. So just this last quarter, we formed what we call a craft group with a number of Genie and Gentu practices to really understand how we could better support their needs. And a number of needs that were identified include the ability to reopen a closed pregnancy record. There's also asks for updates to options that are appearing in drop-down menus within the ONG module itself, and the ability to support multiple babies in a single pregnancy, in addition to the antenatal letter references, which I mentioned we'll be doing as part of that letter reference uplift as a whole. So we're really hoping that this closes a number of gaps for our obstetric practices. And then I guess jumping back out to the mobile app, following on from the work that they did to enable mobile users to review and action results, the mobile team will be initially looking at closing some gaps, information gaps in the patient's clinical records, specifically around incoming documents. But then the bulk of the time over the next quarter is really going to be spent on tasks and notifications. So we know that when practitioners are away from the rooms, they want to have visibility of the tasks list. And they also want to be made aware of when a task requires their attention. So initially, we will be making the tasks list available within Gentu, and then we're also aiming to do our first set of push notifications in the mobile app. So this is where, you know, users will no longer need to log into the app to know that a task or a result requires their review or their attention and action. Within the clinical record then, I guess for practitioners, we're going to be continuing progress on clinical configuration. Again, I spoke about this last webinar, and in the past quarter, a lot of work has been going on in the back end to really help us get ready for enabling users to personalize their clinical workflow experience. So we want to ensure that users can determine what clinical tools are important to them and where they're actually used within their workflow. It's most likely the first version of this will be enabling practitioners to manage the tools that are already available in Gentu, like the past procedures and measurements, and choose, you know, what's on view within the clinical file. And then over time, what we want to do is make available some configurable scoring or clinical tools, quite similar to, I guess, checklists within Genie, if people are familiar with that feature. But our goal this quarter is to have at least one kind of clinical form or tool available to our users. So that will be a great step forward in that clinical workflow space. And then last but not least, we're really conscious that many practices use quite a number of products outside of Gentu for the overall running of their practice. So some examples include, you know, booking products, transcriptions, telehealth, patient engagement tools, and so on. As I mentioned at the beginning, over the past 12 months, we've really been doing the foundational work that's needed to be able to enable partners to connect in and share information with Gentu and be more tightly integrated into core practice management system workflows. We now actually have a number of products in beta, including products for traditional transcription use cases and also digital consent for treatment and procedures. So our initial partners in this space will be Avant VoiceBox and then T-Pro, which some people may know it previously as NTS. And then Consentic is going to be the product that will be available for digital consent. So these partners are in the final stages of completing this integration work. In some cases, we actually have some beta customers who are already on and using these products within Gentu. If you're interested in participating in one of these beta programs for any of the use cases that I've mentioned, or there's a particular partner that you would really like to see integrated, or you would like to participate in a beta program with once it's available, please do let us know. There's actually going to be a survey question at the end where you can just pop in that product or that partner name. But off the back of the survey that we did in June, where we asked, what were the next use cases that you wanted us to focus on, we will, of course, be looking at patient forms as the next problem for us to solve. And again, that's going to be really focused in on the ability to capture patient demographic information and have that flow through into Gentu. And then we'll be turning our attention to online appointments as well as we get closer to the second half of the year. And then finally, really excited to share that we will soon be adding a number of AI transcription partners to the marketplace. So the demand on healthcare providers is growing to the point where we know that a number of practitioners are on or are close to burnout. And we know actually across the entire Gentu application that there's lots of opportunities to reduce the burden of the workflow that's both on admin and clinical practitioners' workflow with AI experiences. And we're looking at a number of these opportunities across those workflows end to end in Gen2. The first step for us, though, is going to be adding a number of AI transcription providers in the marketplace. So many of these providers are providing human-led transcription, but also ambient transcription. And based on the survey that we did in June, we can actually see that about 20% of our practices are already using some of these ambient AI transcription tools. So it's going to be great for us to be able to provide a more integrated experience for these tools with your Gen2 workflow, and really provide that next stage of, or next step in providing further efficiency gains for you and your practice. So our intention is over the next couple of webinars, we'll start to share more with you about what you can expect to see as we evolve Gen2 with AI experiences, but really exciting to see that, initial addition of the AI scribes sooner rather than later. And now that is everything that I wanted to share in relation to roadmaps. So look, thank you all again for your feedback, both through our Voice of Customer program and when we have surveys that we do. That's everything for us today. Thank you again for joining us and listening to the update.